So a couple of options that we like, ideally we're using a lubricant that's mimicking the actual vaginal environment. So we want that good pH. We want to make sure there's no spermicides, of course, water-based and minimal ingredients, right? We don't need a lot of stuff in there. I will say that pre-seed is the most common fertility-friendly lubricant used in fertility clinics. It's definitely not the cleanest in terms of ingredients, but it's got the longevity of RE support to back it up. An annoyance my clients have with pre-seed is how you technically are supposed to use it is to actually insert pre-seed with a vaginal applicator about 30 minutes before you have intercourse. I just talked about this with a private practice client this week, or last week. I can't remember. It doesn't matter. We just talked about this with someone in my world. No, it was someone in FCM yesterday, actually. It was, I had a bonus call with an FCM client yesterday, and she asked specifically about this. And I was like, listen, those are the instructions. I get that. However, like in this world where spontaneous intercourse is already a struggle in the fertility world, where it feels so scheduled and robotic, like to have to add in this kind of annoying, like regimented scheduled thing, I just have a hard time with that. I do. I have a hard time recommending that because I really think trying to keep this journey as not scheduled and rigid as possible is important for you, for your mental health, for your partner, for your relationship, for your intimate relationship. It's incredibly important. So I have clients using pre-seed as lubricant that you would use normal lubricant and have that working just fine. That is off-label use, okay? So just want to say that that's not the instructions, but that is how we use it sometimes. BabyDance is another one that we like, and then Good Clean Love Biogenesis. Those are the three we're typically recommending that have the right pH balance, that are specifically made for fertility journeys. And I know there's lots of other brands on the market. Just want to make sure that that's water soluble. It's got a good pH. It's made for fertility. There's no spermicides. But then on top of that, you're eating the food, you're eating the fat, you're getting the water, you're managing your stress, you're doing the things that give you the building blocks your body needs to actually help try and combat a hormonal side effect. Okay. That's the biggest thing. Honestly, most women feel pretty good. The dryness or the lack of CM is probably the biggest thing we have to combat.